Okay, we'll kick it off since we have a lot of content to go through and we want to respect everybody's time. So thank you for joining and hi everybody. Welcome to today's webcast titled Journey to Zero Trust in Healthcare, featuring speakers from Insight, Cisco, and Order. I'm Mike Sciacero. I'm a practice architect with Insight's Cloud and Data Center Transformation Division, and I will be speaking today as well as serving as your moderator. I have the pleasure to present with two experts in the field, Eddie Mendonca, a cybersecurity technical solution architect from Cisco, and Craig Hypes, the principal technical marketing engineer from Order. If you have any questions during this webcast, please put them in the chat and we will address them at the end of the session. And now I'd like to start the recording and kick off the presentation over to Eddie. Take it away, Eddie.
Great. Well, thank you for the intro. My name is Eddie Mendonca. I'm with Cisco. I'm in the security channel organization supporting partners like Insight. Before that, I worked as a developer on various identity management products like Identity Services Engine and Access Control Server. So what we're going to be discussing today is Zero Trust, and specifically Zero Trust around healthcare and the Zero Trust for the workplace. So let's start the discussion around what is Zero Trust. I'm sure most of you have heard of this, of the term and of the architecture. It's basically a security model, also known as an architecture that that defines a very tightened perimeter around how things access the network. So the term was coined around 10 years ago by a Forrester analyst, and the basic premise is taking the concept of least privilege and extending that to every access request. So I think it's best to describe it in comparison to what we're traditionally used to in a traditional model, which is a certain implied trust. So being that, like, if you're on the corporate network or perhaps you VPN'd in, that there are certain things implied, that you're on a certain VLAN as an example, so you have access to certain things. That all goes away with Zero Trust. With Zero Trust, the perimeter really is the device itself, and that device should be considered compromised and hostile. So how would you treat such a device? Well, in that case, you'd have every access request tightly guarded with authentication and authorization, okay? And another thing I want to call out is you might have noticed that this presentation is called A Journey to Zero Trust. And I definitely want to emphasize that it is a journey. So considering Zero Trust as something that you can achieve would be like, a good analogy would be like Microsoft saying, okay, the next patch Tuesday is going to be the very last patch Tuesday because we're done fixing all the bugs in Windows, right? So that would never happen. Just like you would never say that you're completely protected in your network, you're never going to be compromised. Same analogy applies. So with Zero Trust, it is very much a posture, a journey that we're trying to achieve by taking various steps. Go ahead, Mike. Okay, so now there are some architectures and frameworks that you can research around Zero Trust. I'm going to discuss the Cisco architecture, but I encourage you to perhaps take a look at the NIST Zero Trust architecture, which is published in NIST SP 800-207. But here, let's cover the Cisco architecture, and we like to split up the Zero Trust framework into these three buckets. So reason is it actually makes things a little easier to comprehend as to what you're protecting. So let's talk about the workforce. That's protecting our users and all the devices that they use. The workload is basically your application. So your servers, your applications that reside perhaps in your data center or in the public cloud, or perhaps a combination of both of those. And then what we're going to focus on today predominantly is the workplace. That is providing zero trust for things like your IoT devices, your users, your corporates, your users, your guests, BYOD users, anything that attaches to that traditional corporate network can be lumped into that workplace zero trust bucket. Okay, so now let's take a look at the Cisco product sets that overlap these three zero trust buckets. So you can advance. There we go. So for the workforce, that's predominantly Cisco's MFA solution, which is the Duo acquisition from a couple of years ago. So with Duo, and Duo is a leader in the zero trust architecture, and not only for the MFA, but also for the posture components that Duo provides. That allows you to define zero trust capabilities around your user activity as well as your endpoint activity. Not only do we have Duo as the primary product set that we have for protecting the workforce, but we also have things like our VPN client, which is AnyConnect. We have Cisco Umbrella, which protects your web access, email security, and our Meraki UTM, which is our unified threat management. Workload, that is protecting our servers and our applications. That's predominantly done with a secure workload, Cisco Secure Workload, previously known as Tetration. It also, we also have the traditional Stealth Watch. Well, now it's called Secure Cloud Analytics, that helps protect our workloads by monitoring the traffic and providing enforcement for our actual segmentation. Okay, and then again, what we're going to focus on predominantly the rest of this talk is around providing zero trust for the workplace, and that's done on Cisco architecture with products like Identity Services Engine, DNA Center, and in the combination of those two, which is and the switching and access layer, what we call SD access, or software defined access. Okay, go ahead, Mike.
Awesome. Thank you, Eddie, for that overview. So as Eddie mentioned, right, we're going to be focusing the rest of the presentation and the event on zero trust in the healthcare workplace. And we're going to show you why this is challenging and how we can overcome those challenges and deliver zero trust successfully. But first, let's just look at a brief history of securing the traditional network so we know where we're coming from. Right, up here is an oversimplistic model of the enterprise in DC. So security traditionally has always been focused on securing the perimeter, secure all external connections, and trust internal connections. But you know, this has actually had to change throughout as we've kind of progressed into the modern work environment, right? We started allowing users and workstations and endpoints to access the network remotely, whether it's from home or work anywhere. You know, obviously very, very common in today's COVID age. And to do that, right, we had to start poking holes in the perimeter so those devices could connect back to the internal applications to get the resources that they needed to communicate to. And then the second kind of major event, right, is cloud transformation. Cloud applications no longer are being stored on-prem. And again, we had to poke holes in the perimeter so devices from the enterprise could communicate to their storage or applications that are now held into the cloud. And then lastly, right, the explosion of IoT. IoT devices typically need internet access, and we've put these unmanaged devices in the so-called trust zone inside the perimeter where there's little security restrictions. And these devices tend to be unmanaged, have legacy operating systems unpatched, and can typically be just as risky as external threats. So perimeter security was becoming less and less secure. Threats were more likely to be sourced from the internal environment or the trusted environment as the external environment. So the zero trust really was a change that modern networks needed for a new security model. So let's review, how do we get here? Internal threats, users and devices with network access in the trust zone. limited, and that's because we always had limited visibility in the trust zone. There was no need to uh, authenticate devices, make sure the devices that were connected into the trust zone were supposed to be there. If they had access to the trust zone and they were able to connect to the network, we left them unsecure. And IoT devices, right? These are unmanaged devices. And there's more and more of these that are required, especially in healthcare, to be connected to the environment to run a successful business. And these devices tend to be unmanaged, a lot of times unpatched. They could have access to the internet to do their business function. But again, without visibility of these IoT devices, what they're connected to the network, it's hard to really know exactly what they're doing or should be doing. And then cloud transformation, right? Business applications being accessed off-prem, and critical traffic via the cloud is bypassing the traditional perimeters that we've invested so heavily in. So I hope you're noticing a theme, right, around visibility or lack of visibility as being a major issue. So according to the health industry cybersecurity practices, these are the top 5 security threats in healthcare. Phishing, ransomware, equipment loss or theft, or accidental data loss, or intentional data loss, and attacks against connected devices. So while zero trust, in my opinion, can help assist with attacks 1 through 4, we are really going to focus on attack number 5, which is attack against connected devices onto the healthcare workplace. And medical devices are the focus, right? Medical devices are a major risk. Typically, they have long refresh cycles. Many can have end-of-support operating systems. They are unmanaged, unpassed. Vulnerability is a real concern, but they're critical to patient care. They're critical to the healthcare business. They're critical to delivering effective healthcare. So organizations cannot afford to have these devices offline or have these devices unsecure. So what are the pillars of success for implementing a trust zone in the healthcare workplace? Well, it goes back to the zero trust model. And the foundations of the zero trust model are visibility, segmentation, and containment. So with visibility, we grant access based on the user or endpoint role. And because we know the visibility, we should be able to give that access because of the identity or role of that device. And so we can segment that device. We should restricting that device's access and containing it from other devices connected to the network limits that device's risk footprint. And then continuously monitoring devices. Devices may be trusted at one point, but they may change their behavior. So we need to be continuously monitoring the behavior of those devices, and we could have a targeted separation of that device when a threat is detected. So there's a lot to this, right? There's a lot to starting with visibility, a lot to getting the segmentation, and then a lot to actually getting to a containment model. So where do we start? Well, we start within Cisco with better visibility, right? Better visibility is key, right? I've talked about it in a number of slides before. Better visibility context allows us to have more accurate identification. From accurate identification, we can have better quality of onboarding and then more consistency and security around our access policy. And this is where Cisco Identity Services Engine shines in this space, right? Cisco ISE is able to provide unified security access control through the different entry points into an enterprise network. This is wired, wireless, and VPN. So with ISE, we can streamline the network access policy that's delivered to endpoints based on their identity. And then this is regardless of how they connect. So visibility based on the identity or the network fingerprint of all users and devices connected. So this would be, your endpoints, your IoT, your mobile devices, security cameras, printers, phones. Once we identify the who, what, where, when, and how, ICE can deliver a policy decision about that device. So that allows us to have robust role-based access control depending on the attributes that are delivered. And the other thing that ICE does very well is the robust context sharing. And so ICE, through its communication to all the network devices, through its communication with Active Directory, through its communication with authentication of endpoints, it collects quite a bit of context about those types of devices as they connect to the network. And it is able to share and also ingest these contexts about this network. And we are definitely going to have a lot more about context sharing. So stay tuned to more of this. But wanted to point out, right? So ICE is first is visibility, control, and context sharing. But a lot of organizations we see already have ICE, but they don't have it fully implemented. They don't have the fully implemented of the granular access control, and a lot of times they don't have the fully implementation of the context sharing. And why is this? And it's because the successful implementation of these advanced features is overwhelming. NAC segmentation is complicated, and it can be really complicated when we're doing it without leveraging any type of ecosystem partners. So let's talk about some of the challenges of securing the healthcare workplace. So I've been designing and deploying NAC and segmentation on enterprises over the past 8 years. Healthcare organizations are by far the most challenging. This is because the complexity of the devices. Healthcare organizations have medical IoT, facility, environmental IoT, point of sale devices, vendors, guests, and typical domain joined devices as well, all on the same network that need to have the same level of connectivity. Network connectivity in healthcare also means life or death. It literally can be these devices for some of the medical IoT devices that are monitoring patient care. And network is a service in healthcare, right? Doctors, vendors, patient, and guests all expect quality level of network connectivity when they're in a healthcare environment. But just like most organizations, healthcare providers want to implement the most secure network that can be deployed. But traditional methods we find have been proven challenging to reach the foundations of zero trust, which is visibility, segmentation, and containment. So let's talk a little bit about these types of devices, right? First of all, managed devices. And typically in healthcare, we find that this is going to be about 25% of the devices that are actually connected to the network in today's world, right? So this is going to be your workstations, your MDM mobile devices, your domain joined laptops. These types of devices are relatively easy to identify the who, what, where, and when, and how. Because these devices have interfaces, we can manage the configuration on these devices easily. These devices can tell us a lot about them when they connect to the network through the authentication process. So determining the who, what, where, and how is relatively easy. And then once we know that, segmentation again is not too difficult either. We can create role-based access control because we know the visibility component of these and the confidence is high. And then again, containment, right? Containment doesn't typically be too challenged on managed devices because these devices have interfaces. They can alert the network or they can alert security applications if they have known vulnerabilities or if they've been affected. So what we find is the level of effort for securing these types of devices and getting them onto the network is relatively painless, and more importantly, the accuracy of the security that we're implementing is very confident. But in healthcare, right, healthcare has a lot of IoT devices, and this could be your medical, this could be your security, your facility devices, your point of sale. And we typically find that this runs to be about 50% of the devices in the healthcare. Now, IoT devices many times don't have any interface. They can't tell us who they are through the authentication process. So we tend not to be as confident about the who, what, where, when, and how about these devices, starting with the visibility. So a lot of organizations, because of that, they create, an IoT segment, which is great, right? It separates the risky IoT devices from other resources in the network. But in reality, this segment doesn't really fit any type of productive security model. Like the role that medical IoT devices is no way the same as a security camera or a smart light bulb or an HVAC system. So putting those into the same container doesn't necessarily make sense from a security model at all. And then these devices don't have any type of interfaces, so telling us that they're infected, isn't being able to done on the device. It's always going to have to be done on some type of threat monitoring system. And since we're not confident about the who, what, where, and how of these IoT devices, the level of effort of applying proper zero trust segmentation and containment is time consuming, right? We have to do a lot of research about these devices. We have to work with the stakeholders. We have to monitor traffic flows to properly understand what they're communicating to, so we can give that least privileged access. And because a lot of those tools aren't in place, especially in the trust zone inside the perimeter, the accuracy is lacking. So these types of devices typically don't necessarily get the type of security policy that they need. And then, especially on the first go around of implementing a NAC segmentation solution, the unknown devices, and this is in healthcare, this is going to be typically around 25%. This could be rogue devices, or it could just be a misconfigured device, a misconfigured managed device, or it could be an IoT device that we can't classify because we don't know enough, we don't have enough information from the network to determine exactly what it is. Um, so without any type of identification, segmentation at this point becomes impossible. And then because we don't have any type of context, containment of the device can be done, right? We can contain it as a rogue device, but we don't have any confidence if this is truly a rogue device. And so a lot of organizations are hesitant about containing these types of devices that are unknown without further investigation, and because there could be business impact. So we don't really get into enforcement. And the level of effort for these types of devices really wants to make you pull your hair out, because since we don't know what they are, we have to rely on usually tracking down those devices, either working with resources that are on site where those devices are connected to get eyes on them to actually identify what they are, so we can properly secure this. And when you're talking about an organization that may have, hundreds of thousands of devices, think about trying to hunt down 25% of the unknown devices. It becomes a time consumption process that's really just not scalable to implement these type solutions. And then without any type of visibility, any type of proper segmentation, any type of containment, the accuracy of our security policies is really non-existent for these types of devices. So what we find in healthcare, and really why it's so challenging, is for 75% of the devices that are connected, the level of effort and accuracy is just not effective. So the question is how do we overcome these challenges so we can properly secure these workforces? Because it's great to secure managed devices, but to be honest, those are devices that aren't the riskiest. It's the IoT devices, it's the unknown devices. Those are the devices that we truly need to start worrying about security in the workplace. So one of the things that I like to start thinking about when we're looking at doing a solution for segmentation and zero trust is security is an ecosystem, right? When I first started in security, right, the dream of security operations was to have this single pane of glass for implementing and managing security policy. But just to be frank, right, in my opinion, the single pane of glass doesn't fit the complexity and security controls needed for the modern health care workplace. This is because one product can't do everything effectively and be any good. So network security in the workplace really should be an ecosystem. Security products should be specialized, but they also should be in continuous communication with each other to share context, to assist in making dynamic, accurate security decisions at multiple points in the workplace network. And Cisco ICE, right, is an industry leader in the application of authentication and authorization policy. But ICE doesn't provide behavioral analytics or do vulnerability scans once endpoints are connected. ICE is really good at determining the identity of endpoints that have user interfaces or have known network profiles like voice over IP phones or printers. But ICE doesn't effectively differentiate the difference between medical devices versus facility IoT or even rogue IoT devices that may be connected but have similar OSs to the devices before. So how do we solve this visibility gap? It's we partner ICE with ecosystems. So ICE becomes more effective when partnered with a product like Order. Order is a leader in differentiating and classifying IoT devices. It can scan for vulnerabilities and baseline behavioral analytics. Order has helped us implement and segment healthcare workplace because it helps us do it faster and improves the accuracy of security policy, which at the end of the day is really the limiting factor of why we're not implementing zero trust or segmentation in the healthcare workplace to begin with. So with that being said, I am going to turn the presentation over to Craig from Order, and he's going to give us an overview of the solution and give us a demo. So thank you, Craig, and thank you everybody for your time.
Fantastic. And I'll share for while I'm presenting, but then when I move to demo, I'll probably conserve bandwidth out in my remote area where I'm presenting from. And let me go ahead and grab the share button here. I'm not seeing the control, so I apologize. I don't have the share button. There we go. I'm now the presenter. Thank you. So with that, I'll pick up where Michael had left off, and feel free to give me time checks from my other panelists in case I want to make sure we have time for Q&A. For those who do not know me, my name is Craig Hypes, Principal Engineer with Order. I did spend quite a bit of time at Cisco on the team with ICE, and so one of the key things that provide best around ICE, so was actually a actual that next level in terms of providing visibility and automation, discovery, classification, and
Hey, Craig, we're getting a little choppy audio. Maybe kill the video. I think that might help.
Right. Let me go ahead. I just closed my window, so hopefully, let me know if you can hear me better now.
That's a lot better, Craig.
Okay, I just closed my window rather than stopping the video. Okay, great. So as cited, so you know, when we look at the NAC landscape, you have the extremely powerful solution from Cisco, and that's, you know, not just ICE and the Identity Services Engine, but it's the whole, you know, how do we provide a holistic and cohesive group-based policy and segmentation solution that covers all areas of the healthcare organization. And so one of the other pieces there is that Order is really taking that and supercharging and accelerating the outcomes that you would receive through ICE alone. So the goal is not to either overlap, but to provide augmentation to provide higher fidelity classification, providing high-res details, providing automation for what they call rapid threat containment. If you have threats and being able to remediate, and that was one of the pillars that was discussed earlier. And we see those as core value capabilities of being able to add that. But some of the unique value adds is to say, how do we seamlessly share information between multiple systems? For example, you might have an asset management system, or some of our healthcare organizations, service ticketing and CMMS systems, ServiceNow, Nuvolo, and others, and be able to augment what you are currently doing with ICE that can, once you allow that device on the network, providing continuous security analytics and feeding that information to ICE, being able to detect if devices specific, whether it's medical or the things that are critical to supporting a healthcare organization. Many of our customers would attest that the power, the heating ventilation system, the lighting, all of those are in ways just as critical, because if any one of those fail, this is, the whole ability to deliver safe, secure, and reliable healthcare services is diminished. And then certainly, how do we take this powerful tool set and provide touchless and automated segmentation, things that have been traditionally very difficult. So with that, let's start with that visibility equation. So as called out, many of the things that connect to your network, not just the medical devices, but the facility, the cameras, you might have devices that are supporting your cafeteria. So you might even have a retailer point of sale. All of these devices are critical and are connecting to your environment, but often you're left with just understanding a MAC and an IP. And so with Order, the goal is, how do I provide high fidelity clarity, not just what that device is, but things like the make, model, where is it located at this point, which switch port or VLAN or access point, what specific medical characteristics, things that impact the device's security posture, and then being able to understand, what are some of the things in terms of my segmentation policy around this device. So are the devices compliant? Do I have Alexas that are in my network? And if so, are they in areas that they shouldn't? Recent supply chain attacks at SolarWind. Do I have any of these devices that I need to be worried about? Are they actually communicating with SolarGate sites? How many devices of each type? Which segments? Do they have agents? Are they still running a supported operating system? So while we have organizations that often are managing extremely well their managed user workstations, it's often these IoT devices that continue to run minimal or legacy kernels. Even in brand new equipment, we're seeing them being shipped with something like Windows 7. Are they vulnerable? What's the risk? And how do I start tracking these at a much different level than typically, so I can build policies around it? It really goes to the idea of, how do you apply zero trust to things that lack a explicit credential? When you hear a lot of solutions around zero trust, it almost starts with, what's its identity? And we have to come up with the understanding that a lot of these devices are in service for, in some cases, up to 20 years. So how are you going to provide and establish trust for things that may not have an explicit authentication? For those who work with ICE, there's this thing called MAC authentication. So basically allowing it on the network based solely on its MAC address. So what type of information can we glean? And what you'll see is that this rich information that Order is learning and discovering and providing in a very passively. So it's not, we're not requiring any agents on the end devices. We're not scanning directly the endpoints themselves to say, tell me what you are, which is sometimes can be actually intrusive and disrupt services on some medical and other IoT devices. Through passively discovery, we're able to provide this rich information about make, model, software versions, Is it known to transmit PHI? What's the classification of this device? Categories and groupings. What's the security? Are there any security analytics and risk? And where is it specifically located in my network? So the IT teams, if you're trying to understand when did it connect, when was it last, how is it connected to my system? The beauty here is while this information is readily available within order, it's being infused automatically into ICE so that that information is readily available so that you can have views like this that within ICE that tell you, and this is what's called context visibility. But if you were to draw an imaginary line, this is by default different devices and what the classification, especially for these devices that they don't have any simple ways for the network to understand what they are. They might see something called the OUI, but you're not going to necessarily understand that that was a Braun Infusiomat space pump, infusion pump. What category and group and the risk ratings and any vulnerabilities in its OS. And you can see that now I can build policy within ICE on this rich information where before, in some cases, was very minimal information against which I can understand, is this something that I should trust on my network? So that once devices are classified and we understand details about the device, we're monitoring the communication. So it's that continuous monitoring to say, I know you're this type of device. What is the communication pattern, not just for this particular, say, ultrasound or camera or whatever the vending machine that might get plugged into the network? What's your behavior in context to other things in your peer groups? What communications are going inside, say maybe to the data center? Which communications, and grouping those to understand what are the communications outside your environment and between systems. So this allows us to create something called a flow genome at multiple levels that allows you to see what is normal, what's abnormal, understanding if something, a device all of a sudden is communicating outside its expected patterns, but it also allows us to provide proactive segmentation to understand what's the behavior of a group of devices, and then saying, now I actually know empirically, not guesswork. I know what type of policy I can build to protect this device. So some key things is understanding if it's anomalous, is it communicating to my antivirus servers, quickly understanding why you have maybe a vending machine plugged into that same network or segment as your medical devices. These are all actual use cases we've seen. Do we have devices which are running Windows 7? Are they connecting out to the internet? Are they communicating things like RDP, which many of you realized are associated with different attack vectors? Something unique about order in its segmentation is that when you look at the way organizations typically segment their network, it's often from a top-down perspective. And that's the traditional way, right? It's intuitive. Let me put all my guest users in a segment, building automation and maybe medical and other things in their own groups. And then provide what I call the thou shalt rules. Thou shalt not be able to do this or access that. It's more of a, how do I group things at a high level and say which things or networks I don't want them to try to access. It's very different from a bottom-up approach, which is if this particular, if you in the healthcare industry look at a specific medical device, it probably the MRI only needs to communicate with very specific things. The capsule neuron devices have very prescriptive patterns. The infusion pumps and the patient monitors, they have a basic requirements. They're by default not trying to hit TikTok or zoom out to Amazon or go to some place that would be considered malicious. So how can we create and understand what those behaviors are so that we can actually lock them down to only doing the things they need to do and nothing else, and then inherently protect them from outside threats? And ultimately, there isn't a one size fits all. So I'd like to have a solution that accommodates a flexible model or the best of both worlds. So with order, our goal is to take, and for those who, the for the technical folks who have actually walked through the process, you'll find that there's many different steps into building policies. You first try to understand what it is, and then you build a bunch of policies to say, based on that, this is what I think you should be able to do. Order basically, so don't worry about reading this on the left, that's the eye chart. You just need to be able to see this one button and say, let me click that one button to fully automate what you see on the left. So taking all of the basic building blocks, it's like sending me to my local repair shop. I could have all the power tools and best tools in the world at my disposal, but if I do not know how to use them, or if there isn't a prescriptive guide to tell me how to use them, then I'm going to be lost. It's like trying to create the Starship Enterprise out of Lego blocks without the instruction. Not only does Order give the instruction, it fully builds it for you, so that whether you're doing downloadable ACLs to control lateral movement within your network, or doing VLAN segmentation, assigning security or scalable group tags, and doing SGACL TrustSec policies, and you are looking at other things like rapid threat containment and firewalls. And it's very important to understand that while doing campus-based segmentation is phenomenal for controlling lateral movement, firewalls still have an extremely valuable place to control access out to the internet. And there are many devices, not just medical, that require some type of internet connection for getting updates, getting access to partners, and so on. So with that, we can take and automate the provisioning of things like downloadable ACLs and ICE, group-based policy and tagging for SDA segmentation, to be able to provide controls to help automate the policy enforcement within, say, the firewalls. And my last slide, I'm going to, is just to show that this is one healthcare customer and some of their segmentation use cases. So initially it was just to rationalize what the asset team that was managing the medical inventory, what they thought, because there's a lot of things that were requisitioned that they had in their database. But over time, it's like when I was a younger lad, and we would do this end of year inventory where you actually walked around and said, this is what's in stock. And by day one of the January 1st, it was already out of date because the inventory moves around. And similarly, you're going to see, obviously much greater challenges in a very large healthcare organization where things are coming and going, things are being retired, some things just get walked out of the building, and being able to create an accurate assessment of everything that's connected. But when it came to policy, and they transitioned to say, how do we now take this rich information and understand what's at risk? So Order is providing that, establishing the trust by automatically correlating now things like the make, model, and serial and operating system information, understand what's actually vulnerable by comparing it to things like FDA recalls and ICS cert databases and other threat feeds to be able to say, is this device at risk? Integrating with the vulnerability management systems to understand, is there confirmed vulnerabilities for these devices? Letting the Vol management system know these devices constitute your MRI, so maybe you scan them differently than what you would normally do with another device. How do you build a grouping and a segmentation policy based on the way things actually communicate? Are they behaving normally? And in this organization, they were able to leverage DACLs for doing segmentation to control that east-west traffic for specific devices, but also move towards group-based segmentation by understanding, if I group things in a very specific way, as was called out earlier, you cannot assume that just because it's a medical device, well, they should be put in the same group. Well, does a patient monitor need to talk to an infusion pump? Does it need that infusion pump need to talk to an MRI? And you quickly understand, no, they really don't. So there are going to be some finer level groupings that constitute, in this case, we're saying a cell, that you might create as a kind of a mid-level grouping, but understanding these things do need to talk to other things in your environment, not just medical things, and to be able to establish these policies, to establish a flexible grouping based on their location, their function, the division, such as I want to separate practice from research or from the educational arm. I want to be able to provide the ability for each hospital to maybe segment in a different way. Each one of those use cases are enabled by order. So with that, and I love this slide because it shows that we have a very clandestine demo going on here. So I'll show you the secret demo, and I need to go ahead and log back into my system. And wait for this one is, we've got it secured with two-factor. Okay, so this gives you a sense of the level of visibility that you are getting through order. And so this is a dashboard where we're just showing how things are broken down, the total number of devices, how many are online, how many are off, critical ratings, and breaking them into different types of devices in the system. Being able to see what are the groupings, what types of categories within, say, a specific, if I was to highlight just in medical and see what types of devices or specific classification profiles. How many are running specific operating systems versions, so you can then find quickly which ones are still running unsupported systems. When were these devices discovered? How many of these devices came on the last day, week, 2 weeks? How many have been offline, especially for things that have been offline for greater than a certain number of days? Is it just retired? Did it walk off? Did it get reprovisioned? What types of communication protocols? And you can see this is where we then leverage our ability to be fully network aware. Where are these things located? And I can create a custom view that says managers of a particular healthcare location or group can only see things for certain locations of certain device types. So they're only seeing the things that they're interested in managing or viewing. How are they connected, by VLAN? And these are all hot links. So if I want to see the 972 devices in this VLAN and find out, if this is my medical VLAN, what things which may be non-medical or high risk are in that same VLAN. And then going further into the system in terms of, other critical stats. So we're not just discovering the direct devices, but we can also detect the devices which are connected behind serial and other gateways in the system. So for this, just to show, the highlight on the visibility, I'm going to jump into medical devices. And you can quickly see, we're providing some of the core information, but we allow you to view it in any way you wish. So if I want to actually see what do these devices look like that were discovered, you could see with these other views in the system that you're able to quickly run and drive into information that was learned from multiple sources. And these integrations are bidirectional. So once you have this rich set of information, you would want to share this back out with your security event management systems, your vol systems, your other your asset management system, making sure it's in sync. But certainly one which we'll be highlighting today is how do I integrate that and share that with ICE? Let me go ahead to the classification view, and I'm going to drill in on some of the focus here on based on the risk, and just show again some of the examples for here, the rich detail that was learned about this device, even down to DICOM information, where is it specifically located, classification, security information, what known vulnerabilities or FDA recalls can be associated. And these are all linked to the sources. So if you needed to delve into that and get more detail. We're even seeing now, not specific to NAC, but how is this device being used from a transactional case study perspective within my medical environment to understand the utilization across different devices in my network. Let me know how this device has moved, integrations with other asset management systems, which users have logged into this device and when. provide me more details in terms of the clinical information. So correlation to things like MDS2 forms, leveraging the 510K numbers for the FDA to get more specifics into that device, as well as the risk for this particular device, and understand, what is the expected communications, what is the risk level at multiple factors. And we are monitoring for different security risks. This particular device certainly has a lot of activity going on with it. But one of the things that we've tracked is the behavior of this device, which is for every device and group of devices, what is its behavior? So this is our flow genome, where every one of these steps in this spiral staircase represents something it talked to. What protocols, applications, when it occurred, how much, is there risk associated with it? And then understanding, is that traffic going inside or outside my environment? Why? Because ultimately, not only do I want to be alerted if this device or group of devices behaves unexpectedly, but I want to then translate this into a behavior that I can enforce automatically into something like Cisco ICE or my firewall system. So you can see that I can, with a click of a button, and that's what I'm going to drive into next, is to show you how do we leverage this policy automation to drive segmentation. One very quick look to say, these are a lot of the metrics we're tracking from a security perspective. So that continuous monitoring, correlating the vulnerabilities and recall information, late breaking threats, order advisory, as well as public advisories, which infections might be, and other security issues that are validated against that device. What communications internally that we've detected, for example, this device was being spoofed, or it was part of a DOS or reconnaissance attack, or things it's talking to out in the internet that we should be alarmed. Then finally, before I jump into the segmentation piece, is how do we break things down? And so you can see whether it's a medical device, medical mobile, medical workstations, servers and gateways, as well as all of the other things. So it's not just limited to medical, but how is everything in my network communicating? So I can say, oh, I have medical devices that are talking to social media sites. What exactly? So here we have, in this case, we've got devices going out to Facebook and Instagram and TikTok, being able to look at maybe it's prohibited sites, and understanding what are the things and locations that these devices are communicating. So I have two devices which are obviously talking to sites that we probably didn't want, and being able to leverage that for segmentation. And these views take it to a logical view of saying, how do I then, even down within medical devices, understanding how the angiography group versus the SPECT versus patient monitoring, how do they communicate both internal to my network as well as external to my network, so I can really understand where the threats are at. So let's move to segmentation. And I've got just take a couple seconds here to show the level of automation that Order will bring to ICE. So in this case, we have a number of different devices, and I could build policies based on a specific type of device, whether it be a phone, MRIs, infusion pumps. The point here, though, is often within an organization, you're going to have devices, say cameras of different types. You're not going to try to create a policy for each model. And at the same time, it's much too vague or broad to be able to try to say, I'm going to create one big Uber policy around cameras. Is this a camera that's in a surgical, being used for surgery? Is it monitoring our parking lot? Is it in the visitor or patient room? So we have the notion of this policy profile that allows you to group devices in very meaningful ways, like all of the infusion pumps at a specific location that's managed by ATM, or patient monitors, which are being used within my research organization. The value here is that I'm not just throwing devices into a bucket based on certain criteria. It's the fact that I can then say, you know what, let me assign this specific device to a specific scalable group tag. So I can then say, let's take this and assign it. I have a SGT that I have assigned for patient monitors, and be able to assign them to that group. So here, let me go ahead and grab that one more time, save that out. And I'm going to do one more example while we're here, is around security cameras, and I am going to assign these devices to the camera group. Now, the moment I did that, the first thing I want to show is that all that rich information about every device is already populated from order into ICE. So you can see these rich views based on the types of devices, OS, its criticality, and this columns can go on and on. But I can build business relevant policies around this. But what I just showed was we can take that to another level by automating that segmentation policy, so that you can now see, if I refresh the screen, this is the what's called the authentication or live log in ICE. I didn't have to go in and create a bunch of custom rules and policies and what's called profiles. For those who've, talked to your ICE management team, it's very complex. With the click of a button, we now have things being put into the right group tags. If I take that one step further and I say, boy, it'd be great if I could take those devices and limit them only to the things that they needed to do. Disallow all the stuff which was unexpected, these yellow elements, and only allow the good stuff, the things which are in my baseline, which is safe and approved behavior, so that I can then take that and say, well, sure, you could generate the CLI and show what would that policy look like depending on how I was applying it to the network. But I'm going to automate that and just say, you know what, let's take this to another level and say, let's go ahead and enforce those policies at the switch. And with that, we'll then see that all of these devices will now start getting a new ACL applied to them. So they're not only getting the right group-based policy, but they're now also getting the right ACL to lock them down to only do the things they need to function and nothing else. I know that was a lot, but I'm going to stop there and go back to the original screen to wrap this up for Q&A.
Thank you, Craig. What an excellent demo. Just a couple questions that came across. So, and this one's probably for Eddie and Craig. Do we have to have a Cisco network to apply zero trust with ICE and order?
Yeah, this is Eddie. I could take the first stab at that. The short answer is no, but the long answer is it depends on the functionality you're trying to achieve. And I think with that tee up, I'll let Craig elaborate.
No, and so that's exactly it. So ICE it does support multiple vendors and switches and wireless systems. But certainly when you look at the providing a very scalable group-based policy segmentation solution that encompasses campus, data center, WAN, and cloud, the whole ability to effectively apply segmentation across the environment, there are certain features which are unique to the Cisco product set.
Excellent. And another question for Craig. What data is being shared with the order controller? Patient health data, or is there any limitations on that?
So we are passively inspecting the information. We do not process or store any PHI data, things like that. We're just looking at the information necessary, the metadata, to effectively classify, pull out the rich context, and then sharing that with ICE and other systems. So we are not doing any type of pushing patient records or anything. There's none of that. So no concerns. We have, again, many healthcare organizations that have deployed our solution and vetted that point very closely to make sure that the system's secure and not in any way leak a potential leak for private information.
Excellent. Okay, well, we're at the top of the hour. Not to put Eddie or Craig on the spot, but if you guys want to hang out for a few minutes, I'll unmute all the participants, and anybody wants to hang out and chat, I'll certainly stick around. And if anybody else needs to drop, thank you for joining and letting us present to you today.
So I do see a late question on scale and the number of clients that looks like it's pointed at order. If you want to take that one, Craig.
Sure. So we support organizations with hundreds and thousands of devices. We, depending on the deployment, we may marry in terms of one for one with the ICE deployment. In terms of, often you will see cubes upwards in size of, usually I haven't seen a cube go well over 1 million, but if that was the case, but there's certainly an opportunity to provide, Uber views, if you will, to say, how do I, if I do have multiple ICE instances, how could I potentially provide a consolidated view of all of my assets?
I see a second part of the question. In fact, I think Keith Harvey is still on the WebEx. Keith, if you want to just unmute and ask the question. The question was around managing clients that might get purged from one system or the other, from ICE or order, and how they get synced back up.
Gotcha. So so there's different logic that could be applied. So if there is a purging which says delete this from one system, once we've pushed it to a device, once it's been either added or updated, we do not continuously. So if it was deleted from ICE, it would only get re-added if you were to say, I want you to re-push everything over to the system. So there is different logic that can be applied, but by default, once we've added a device, we don't go and keep adding it back into the system. Because I know there is cases where I've heard working with different Cisco folks where there are solutions out there that would just keep pushing and adding it new. But yeah, if you do run into that situation, please let us know, and then we can make sure that that the right logic is based on your requirements are being applied.
Great. Any other questions? You can just feel free to jump off mute.
Okay. I'll take silence as gold. If anybody, feel free to reach out to myself or your representative with Insight if you want more information or have any questions. Again, thank you for attending and sitting through this presentation. And thank you, Craig and Eddie, for contributing your content.
Glad to help.
All right.
Thanks for hosting, Mike.
Yeah, no problem. Hope everybody has a great week. And hopefully we'll be talking to you soon.
Thanks, everyone.